Ptosis operation or double eyelid operation? I've had lazy eye, or ptosis, since I was young. I've always had double vision whenever I wanted to concentrate on something, but it happens only once in a while. Should I have an operation done? And what operation should I do? I'm 17 going on 18, so I'm becoming a little more self-conscious about myself.
Thank you for your question. You're 17 years old going on 18 and you submitted a single photo that demonstrates the presence of a ptosis involving the right upper eyelid, and that you state that you've had this, quote, lazy eye since you were a child. You mentioned something about double vision that occurs when you concentrate, and so we can talk about that as well. And you're asking about whether or not you should have this addressed. Well, as a specialist in eyelid surgery and as oculofacial plastic surgeon, eyelid ptosis is a very common issue that we deal with. And when it comes to congenital ptosis, prior to the age of 6, it's important to make a decision about correction based on visual development. However, after age 6, it becomes more about the aesthetics and symmetry. Naturally, it should also involve the functionality, but I think that you can probably get a sense of whether or not lifting the eye will be in any way interfering with your visual function simply by manually lifting up your right upper eyelid. That being said, I think you should have at least a full ophthalmic evaluation and see what the best corrected vision in both eyes are and see what the impact would be of lifting the right upper eyelid. A lot of times if someone has a condition such as amblyopia, where one eye becomes doesn't develop, the visual function doesn't develop as much because of partial occlusion of the eye and lack of stimulation before the age of 6, then it is usually not necessarily a problem because they've, quote, suppressed the vision in that eye and it's more about the aesthetics. But assuming that you can tolerate the eyelid being opened, I think that you have the choice of when to do surgery is a personal choice. If the drooping eyelid bothers you enough, then having the procedure makes sense. I always tell patients, or people who have, I've always observed, I should say, people who have had congenital ptosis, is they'll have a minimum of about 3 operations in their lifetime. One will be when they're very young for functional reasons. One will be in the teens to 20s for cosmetic reasons. And then if the eyelid stays open, and it again depends on the type of ptosis you have, then one in the later decades because everything starts to droop and the eyelid needs to be lifted again. So in your situation, I'll describe for you what we would do for a patient like yourself. First of all, you have to see what kind of ptosis surgery is appropriate for you. There's ptosis surgery that's based on good muscle function, and then there's ptosis surgery that's based on poor muscle function. So depending on that, we would figure out whether to shorten the levator muscle, the muscle that lifts your eyelid, or whether to do something called a frontalis sling, where the eyelid is actually attached through some kind of connection between the eyelid margin and the eyebrow, so that when you raise the eyebrow, the eyelid opens. So that being said, I think another thing that we would do in our practice for patients who are not children but are old enough to cooperate is we actually do the ptosis surgery with local anesthesia with light sedation, and we'll have a patient be awake for the adjustment of the eyelid. This is a specialized area, and a tricky thing about ptosis surgery is about achieving the optimal shape, contour, and height so that there's maximal symmetry. You know, if you're bothered by the asymmetry of the eyelid drooping, well, you don't want the eyelid to be too low or too high after the surgery. We try to balance this by doing this procedure and actually having our patients sit up during the surgery. They never feel any pain, but at least we're able to try to judge whether or not the eyelid will be stable and looks good with gravity factored in. Ptosis surgery can turn out to be very, very gratifying for the patients and make a tremendous difference in their appearance and their confidence. So it seems, based on the limited amount of words used in your question, that you do have a concern that maybe will have an impact on your confidence. And so getting some opinions from professionals and specialists such as oculoplastic surgeons or oculofacial plastic surgeons will give you an idea of what your options are. So I hope that was helpful. I wish you the best of luck, and thank you for your question.